The most important part about my job of consulting patients, consulting sportsmen and women, consulting hikers for their problems is trying to motivate them in doing their exercises on a daily basis and increasing them progressively and becoming stronger. So reversing the problem to an intrinsic problem rather than searching for the extrinsic solution. And that's a major part of my job, you could say. My name is Koen Peers. I am the head of the Department of Physical Medicine and Rehabilitation at the University Hospitals in Leuven. I treat sport injuries, and I'm also the head of the Sports Medical Advice Center in Leuven. Well, indeed, every sport has its own injury, you could say. And hiking, we consider it to be a moderate impact sport. It has overuse injuries and acute injuries. Acute injuries like the ankle sprain, the classical ankle sprain, and a calf muscle injury. And overuse injuries, mostly the tendon injuries, the tendinopathy problems, Achilles tendinopathy, patella tendinopathy, but also bone-related overuse injuries like a stress reaction or a stress fracture, and it becomes worse. And the classical, of course, skin injury like blisters, and sometimes nerve impingement injuries. Those are the type of overuse injuries we see for hikers. But hikers are athletes too. I think it comes down to the fact of what we're used to. And if we're used to walking barefoot is okay. You might remember the South African middle distance runner Zola Butt. She always ran barefoot and not that bad. But nowadays we're used to using shoes, and then we need to find the right shoes for a long distance hike. Shoes can provide cushioning. Shoes can mitigate the ground reaction force, for sure. But people are intrinsically lazy, you could say, meaning that we ourselves can provide this cushioning too by strengthening our muscles, and the effect size is far greater than what the shoe can deliver. So mostly, or for many hikers, I have to say that first let's concentrate on the effect of strengthening the muscles, having this kind of effect, and then afterwards we can look at the shoe having this kind of effect. Both are important, both can help prevent some injuries, but strengthening can help more than the shoe itself. Stability might be created by the heel part of the shoe, but it's a specific stability related musculature that can help you too. Muscles like the peroneal muscles and the tibialis muscles, you should train them a lot to prevent you from, for instance, the typical ankle sprain. Well, for ankle sprains, what we do know is that prevention works. Internally, by strengthening the musculature that stabilizes the ankle joint, like the peroneal muscles and the tibialis muscles. Externally, by bracing or using higher boots. Again, the effect of the strengthening in the muscles is far greater than using the ankle brace or the higher boots. I am not convinced that there is one ideal way of walking. We do know certain rules that we can apply when we measure out athletes, when we measure out people with certain limitations or certain pain problems, and we can measure whatever you want. We have the 3D videos that we can use. We can have the footprints from the ground reaction force. We can have the electromyography of using which muscles that you can use. We can measure that out, and we can try to adapt that individually for the individual problem that there is. But that doesn't mean that we have to advise everybody to walk in the same way. That would be very, very wrong in my opinion. Look at the most famous marathon runners. They run marathons in 2 hours and somewhat these days, but they all have a slightly different way of running, a slightly different way of putting their arms while running, a slightly different strike. It's their own individual stride, you could say. Insoles can help, for sure, no doubt about that, but they're not necessary for every problem with the foot that we have. And in two ways we might make mistakes about that. One is, let me tell you the typical story that I see here at the hospital. When you see somebody, let's say of 45 years old, desk job, no sport at all. They go out for a weekend hiking or a city trip. So during the week, they're used to having 1,000, 2,000 steps a day. And during that weekend, prolonged weekend, they perform, let's say, 15,000 steps a day, 3 days in a row. After that weekend, they have heel pain. Probably, most likely, plantar fasciopathy. Most likely because you're not used to it. The plantar fascia tells you, hey, we're not used to doing 15,000 steps a day. But when people come back from their city trip, they go to the doctor and they tell them, hey, I have heel pain. And what we do then mostly is try some insoles to have more cushioning and to relieve the pain. It's not wrong to do that, but it's not the cause of the problem. The cause of the problem is most likely the distances that you used to do during a day. And the solution for the next city trip, of course, is strengthening and building up your distances. Mm-hmm. The second thing I wanted to say about measuring out your insoles is quite important, that don't try to fit them while having pain. Because at the moment that when you have pain, that will impede you from having your normal footprint. So you will end up with soles that are not fit for you. So when possible, try to get rid of the pain first by having the right treatment for your problem, and then try to figure out whether you need insoles or not, and fit them while having no pain at all. That's the more sensible chronology, I would say. Okay. And many people do it the other way around, and then you see some odd solutions. Theoretically, a foot longitudinal arc problem might create a different mechanical moment at your hip joint, in the lower back, and so on. But even when these associations are proven in some scientific studies, an association is not the same thing as a causal relation. It's not because you have flat feet that you will get back problems when you perform a long distance hike, for instance. It might be a risk factor. Then again, there are many more people with flat feet without problems than with problems. You can be very much in shape cardiovascular-wise, having a good fitness, being able to run for miles and miles. That doesn't mean that you have the right strength or muscular fitness. And you need a bit of both, or the right balance between both of them, depending on what you want to do. And there is a difference in running uphill, running downhill, running on flat surface, running on uneven surface. uneven surface, more mud, you need more musculature. Running uphill, you need the muscles, also for downhill. On flat surface, even surface, you need it less. When you're carrying a backpack, it's extra weight. So you need extra strength to carry that uphill, for instance. Indeed, nowadays you have the ultra-light hiking community, and they prefer carrying 4 to 5 kilograms of backpack for even long distance hiking, and they prefer the trail running shoes. Then again, you have the hikes that you perform sometimes with the necessary backpack of 15 to 20 kilograms. Mostly those people would prefer, for instance, the high leather boots and create more stability. And the heavier your backpack is, the more problems it can create for the back, but also for a certain type of nerve injury in the shoulder region that is typically related to backpacking. So a backpack that is in relation to your own weight is kind of very important. The backpack should be carried more on the hips and in the pelvic region than on the shoulder joint, because then if it's overweight, it might create a nerve injury causing serious shoulder problems.